When we're about to start treatment for thyroid eye disease, we sort of have a four-pronged approach. The first one is lifestyle modification, which modifies environmental factors. The next one is symptom alleviation to make a patient more comfortable and relieve their symptoms. The third one is medications, whether IV or oral. And the last one is surgical, which we reserve for very advanced cases.
The treatment of thyroid eye disease typically entails a coordinated effort between different specialists, an endocrinologist, an ophthalmologist, and ear, nose, and throat doctor. At first, we have a conversation with the patient to make sure that they don't have any toxic life habits, particularly smoking. Smoking can dramatically increase the risk of progression of thyroid eye disease. After that, you need to see an ophthalmologist in order to establish how aggressive your disease is.
Now, to treat some of the symptoms, what I'm an expert in is the cornea and treating corneal exposure, which basically means that the eyelid doesn't cover the cornea all the way. You want to do lubricating drops, gels, ointments, sometimes taping the lid shut, sometimes doing that in a surgical fashion where you suture the lids shut. Those are all very helpful. If somebody has double vision, putting prisms and glasses can be incredibly helpful. And then more intensive treatment involves IV or oral steroids. Can do orbital radiation if the inflammation behind the eye is really pushing the eye forward. And there are also some IV immunologic drugs that actually treat the disease on a molecular level that are very important.
Now, it should be noted that sometimes patients have traumatic or acute eye-threatening disease, meaning severe disruption of the optic nerve or of the cornea. Those patients need to be triaged rapidly so that they receive the adequate treatment, which would be surgical in that particular instance. So most important thing is that if you suspect that you're having thyroid eye disease, is that you see the right doctor.